Can I come in?
Yes, you can.
Hello, my name is Jack. I'll be your student nurse today.
Hi.
I'll be doing your head to toe assessment. Really quick, can you give me your full name, date of birth?
Justin Nakaoka, January 14, 2001.
All right, Justin. And do you have any allergies?
No allergies.
Okay, let me just verify your bracelet.
Okay.
And then, Justin, your vital sign seems good to go, and no allergies as well.
Okay.
So what brings you in here today?
Just left ankle injury.
Okay. And what were you doing when you?
Just playing soccer and then kind of like just twisted my ankle. Just hurts to walk. I guess.
Okay. And when you fell, did you like put out your arms and hurt your arm at all, or just your ankle?
Just my ankle only.
Just your right ankle.
Yeah.
And when did that happen?
Like 3 days ago.
Okay.
Yeah.
3 days ago.
Mhm.
Okay. And what makes it worse or better?
Just like staying off of it just makes it better. It's tolerable now though.
Okay.
Yeah.
And if you had to describe it, how would you?
It's probably like a sharp, achy pain, like every time I like step on it.
Okay. Sharp and achy, you said?
Yeah.
Okay. So as far as the severity, let's do the 0 to 10 scale. How bad would it be?
Right now probably like a 5.
Okay.
Yeah.
And you said it was 3 days ago?
3 days ago, yeah.
Okay. And you said the 5. Is that tolerable for you, or do you want it to like go down?
At the moment, it's tolerable for me.
Okay.
Yeah.
Cool. Really quick, can you give me the location of today?
Yeah. Today's Wednesday, and we are at Concordia University.
Okay. And do you know who the president is?
Trump. Sorry, Biden.
Biden. Do you know his first name?
Biden's first name.
We'll go with Biden. All right.
Yeah, let's go with
We'll
Biden.
Biden. Okay, sounds good. I'm just going to do your head to toe today. And patient looks comfortable here, sitting here. Patient's skin tone is equal to ethnicity. I'm going to put on some gloves really quick. And patient is ANO times 4 as well. All right, so I'm going to start your head and then work my way down, okay? Okay, just gonna look at your hair, looking for any alopecia, any loss of hair, any redness, any lice. There's nothing in there.
Mhm.
I'm going to look inside your ears really quick, okay? Gonna pull out and up, looking for any redness, any, looking behind the ears for any loss of skin, any excess cerumen. Excuse me. Do you wear any hearing aids?
No.
Okay. And now I'm gonna go ahead and just palpate your pulse here, temporal pulse. Temporal pulse is equal bilaterally, 2 plus and regular. You can go ahead and look up for me. Just right at me.
Sorry.
Okay, you're good. Just follow this, okay? I'm gonna check your gaze. Okay. And just, can you go ahead and look behind me?
Yeah.
Okay. Pupils are equal, round, and reactive to light and accommodating. Do you wear any contacts or glasses at all?
No contacts, no glasses.
Okay. And really quick, I'm just going to touch your face and check your eyes, okay? Looking at the sclera and conjunctiva of the patient. Sclera should be white, conjunctiva should be pink and moist. And now I'm going to check your nose, okay? Just go ahead and look up for me. Looking for any deviation, any excess mucus, any redness or bleeding. Everything seems fine. Can you go ahead and open up your mouth and say ah for me? Looking for lacerations, obstructions. You're good. Laceration, obstructions, blood, broken teeth, and mucus seemed pink and moist. Tongue was symmetrical. And on that note, the patient's face is also symmetrical as well. Okay, now I'm going to palpate your carotid pulse. Carotid pulse is equal bilateral, 2 plus and regular. And just go and look straight for me and then turn left and right. And do you have any problems swallowing at all? No. And looking for tracheal deviation and jugular vein distension. There is none. I'm going to check patient's turgor. Patient is healthy, or patient is hydrated. Okay. Now, just go ahead and tell me if you feel equal sensation on both sides when I lower my feet, my hands. Did you feel both that equally?
I felt that.
Okay. Check brachial pulses. Brachial pulses 2+ regular, bilaterally equally, and then radial pulses equal 2+ bilaterally. Now I'm going to go and test your capillary refill. Capillary refill on all digits are good underneath 2 seconds. Now go ahead and squeeze my fingers. Perfect. And pull. Push. Alright. Strength is 5 out of 5. And good. Can you show me your elbows like this? Okay. Looking for any breakdown on the elbows and skin. Skin seems intact, no redness. Go and put them down and raise your hands up to the sky and back down. Alright. Seems good. Range of motion is good. Strength is 5 out of 5. Okay, now I'm gonna go ahead and listen to your lungs, okay?
Mm-hmm.
First I'm gonna inspect the lungs, looking for bilateral rise and fall of the chest, front, and then the side, both equal, and the back as well. I'm gonna touch the patient's, go and take a deep breath for me. Okay, equal rise and fall of the chest, posteriorly. Alright, whenever I touch you with this, go ahead and just take a deep breath for me, okay? Another breath. Okay. And same thing back here, okay? Okay. No adventitious sounds. Clear. The lungs are clear to auscultate bilaterally, equal on both sides. Now I'm going to go ahead and listen to your heart, okay?
Mm-hmm.
Aortic, pulmonary, herbs point. Tricuspid, mitral. S1 and 2 are heard on all sites. Now I'm going to listen to the heart for 1 minute at the apical pulse, for 1 minute at the midclavicular line, 4th or 5th intercostal. according to the chart, the patient's heart rate is 89 beats per minute and the respiratory rate is 14. Okay, now I'm gonna ask you a few questions about your diet, okay?
Yeah.
As far as eating, how many meals do you eat a day?
Try to eat 3, probably I'm eating like twice
Okay.
a day though.
And for bowel movements, how often do you make one?
Bowel movements, probably like 2 to 3 times a day.
Okay, and what do they look like?
Soft and brown.
Okay, normal, good. And for, how often do you pee a day?
Today I've gone 3 times.
Okay, do you normally go a decent amount?
Yeah, decent amount.
Okay, and the color of it, and does it smell?
No, it's like light yellow, doesn't smell.
Okay, awesome. Okay, I'm gonna now move on to your abdominal assessment. Just go ahead and lean back for me, and I'm gonna raise. Alright, mind if I lift your shirt? Okay. First, I'm going to look for any masses, pulsating masses, contusions. I don't note anything. I'm going to auscultate all 4 quadrants. Upon auscultation, I hear normal bowel sounds. First, I'm going to do light palpation, looking for any facial grimacing, feeling any masses or pulsating masses. No facial grimaces and no masses felt. I'm going to go ahead and move on to deep palpation. And also feeling the bladder as well. Bladder, could not feel the bladder. Did you urinate recently?
Yeah.
Okay. And go ahead and come back on up here. Okay, normally I would check the femoral pulses, but for this exam we're not going to do that. I'll move on to the popliteal pulses. Both pulses are equal bilaterally, 2+ and regular. Gonna check for edema on both shins. No pitting edema. I'm gonna check leg strength. Go ahead and raise your knees up for me. All right. And pull back, and then push forward. Cool. I'll check posterior tibia. And really quick, can you take off your shoes? And socks. Posterior tib was equal bilaterally, 2+ and regular. And dorsalis pedis is also equal bilaterally, 2+ and regular. Go ahead and raise your toes up for me and push down for me. All right, you can put on your shoes if you like. All right, go ahead and grab my arm. I'll help you down. Can you walk to the door and back for me, please? Noting patient's gait. Their gait is normal, no limping on the right foot. All right, and then can you hold on to the bed for me right here? And just go ahead and mimic my movements. Right leg out, and then forward, backwards, and then the other leg as well, out, forward, and backwards. Okay, patient's range of motion is normal, and patient's full body strength is 5 out of 5, and that will conclude our head to toe assessment.
Thank you.